Hello and welcome to another episode of Chiro Mom Car Talk. My name is Dr. Hania. I'm from Westview Wellness.
And I'm Dr. Caroline Long. We are really lucky to have two pediatric dentists here today, Dr. Adam Shisler and Dr. Brenden Taylor. They're pediatric dentists and partners with the Camerata Pediatric Dentistry Group.
We wanted to talk to you guys a little bit about when to take your child to the dentist and just give you some anticipatory guidance regarding things to watch out for diet-wise that could cause cavities, some good strategies on brushing teeth, brushing your little one's teeth, and also talking a little bit about different things like habits, thumb sucking and finger sucking and pacifiers, and when to think about maybe weaning the kiddos off of those things.
So the first thing I think we always have, the big question is, when do you take your kid to the dentist? Like, what's the proper term? So we have guidelines as pediatric dentists that will tell us, it's always 6 months after the first tooth that comes in or by the first birthday. So that's kind of like the standard company line. In our office, we usually see our kiddos between the ages, they'll come in between 14 months and 18 months of age. And that's really good just because, they may have 2 teeth. Like my daughter only has 4 teeth and she's 15 months old, but then they may have a lot of teeth. And at that time, we are not only just checking to make sure that those teeth are healthy and the enamel quality is good and that the order is correct, but we're going over all the other things that Dr. Taylor was talking about. What is the diet like? Have we transitioned to solids? How's the swallowing function? What sort of non-nutritive habits are going on? And we can talk about those things in a very easy, friendly environment. So an example of that would be, when they are transitioning to solid foods, what kind of foods are they eating? And we can talk about carbs.
Mm-hmm. Yeah, so simple carbs are going to be the types of foods that are going to cause cavities. Simple carbs break down into sugar, and so we all know that sugar causes cavities inadvertently through a reaction that basically demineralizes teeth. So simple carbs, the tough part about this with kids is that all of the kids' snacks, or a lot of the kids' snacks, are simple carbs. So your Cheez-Its and your Goldfish and that kind of thing.
Teddy Grahams.
Mm-hmm. Yep, absolutely. So not to say that your kids can't have all of that stuff, and occasionally, of course, it's okay, but it's going to be very important that you are brushing those kids' teeth and that you're going to minimize the frequency of snacking, which is a really big thing. So kiddos that are going to be grazing on Cheez-Its throughout the day, they're going to be constantly exposed to that simple carbohydrate, which again was going to be breaking down into sugar, and then that causes an acid reaction that demineralizes those teeth. So you've got to watch out for the frequency of those. Some really good snacks that would be good for kiddos are things like cheese. Fruits are, of course, really good and healthy. Fruits also contain sugar. Some fruits with a little bit of less sugar are apples. That would be also another good one. So you want to kind of be thinking about some good healthy snacks that really don't play into cavity making. So just be cognizant of the type of snacks that you're giving your kiddos. The other thing that's out there too are really sticky snacks also. So your fruit roll-up type things. You've got a lot of organic options also too, but remember, sugar is organic as well. And so you still have sugar exposure with those things, and the stickier foods are, the more likely they are to stick to those teeth for longer periods of time.
So then that kind of lends us to, how do you go around brushing all of these carbs and fruits and gummies off the teeth, and when do you do that? As soon as the any tooth starts to erupt, getting a toothbrush in there, an actual bristled brush is great. The silicone bristles, which are really easy on the gum pads when they don't have any teeth, those are wonderful when they don't have teeth. But once you got an actual tooth in, switching over to a bristle is really important, because that bristle will help debride and mechanically remove any sort of plaque or pellicle that is there. And that's really, really important. Any soft bristled brush, we don't have a favorite brand. We don't have anything. It's just something that is really soft, or an infant toothbrush that you can get in there and get everything clean, because that bristle action is going to actually kind of break up those sticky carbs that like to hang out there. And our young kiddos, muscle function isn't necessarily as fine-tuned, so they're not going to be able to sweep their tongue over and break up the gummies that stick on their teeth, or the carby puffs that stick on their teeth. That's what the bristles are for. So get in there and brushing, and as soon as they start allowing you can start to brush those front teeth, you can start moving into the back. Brushing on top of the gums, on top of the tongue is really important. Then the other thing that we kind of like to talk to parents about is, what do we find is the most important when they're not eating? You know, is there anything in their mouth when they're not eating? Is there a pacifier? Is there a thumb? Are there fingers that are sticking in there? Are there the shirts or the collars of their shirts or their fingernails? And kind of talking through what that is. Not saying any of that stuff is necessarily bad, but prolonged usage and high frequency of usage of that stuff is where we kind of get into it changing the effect of their bites. Our kiddos look like skin and bones, but there are a lot of, cartilage transitioning to bone in those really young ages that can be highly influenced by the presence of a thumb or the presence of a pacifier much longer than we would really recommend. Not saying that as a parent giving your kid a pacifier is a bad idea, but that prolonged usage long-term, well past the ages of 24 months, 36 months, 4 years, 5 years old, that's where you're going to get some significant orthodontic changes that could be, definitely unwanted.
We'd like to, get kiddos in early so that we can start counseling on that kind of thing, and then give you strategies on how to try to wean kids off of whether it be a passy or a finger sucking or thumb sucking, that kind of thing. But I think the point of this is all to say is these are growing kids, and so anything that you stick in there prolonged is going to start to change the growth of the face over time, and they do serve their purpose, but at some point, weaning the kiddo off of something like that is going to be really important for their overall facial growth.
When we're talking about just cavities or prevention of cavities, prevention goes a long way. In our office, we really foster a unique, caring, fun environment that's prevention based. Kids will get cavities and can get cavities, but a lot of them are preventable. So if we can spend a lot of our day talking to you guys about prevention versus talking to parents and kiddos about fixing cavities, that's what our preferred method is, because a cavity is a bacterial infection. It is a disease process that removes healthy tooth structure and substitutes it and takes away with a bacterial infection. That's why you can't ignore cavities in baby teeth. They will grow and they will get larger, and you can have some very serious problems. So getting your kid in early and getting proper steps and proper hygiene techniques in place are very, very important to prevent any sort of event that could possibly lead to a cavity.
Yeah, and actually, speaking of prevention, one really common question we get is fluoride use and fluoride toothpaste. Should we be using fluoride toothpaste? And actually, the current guidelines state that we should be. Kiddos, as soon as they get their first tooth, we should be using a little bit of fluoride toothpaste. Now, I know that young kids, they are not efficient with their spitting, and so some concern is that, these kids are swallowing toothpaste. So where you can control this is the amount that you put on the toothbrush. So the younger they are, just a smear at the tip of the toothbrush. But that fluoride is going to be a really important thing to put on those teeth. It'll provide a topical action to just strengthen areas that are trying to break down. And that's just it. With eating things, again, it changes the mouth into more of an acidic environment, and so you're more likely to develop a cavity in that environment. So that fluoride really, in those areas that are trying to break down from that acid reaction, that fluoride is going to strengthen that area back up. And of course, working on the spitting with kiddos will be important. And I will tell you, I think probably around 3 years old are when kids really finally get the concept of spitting out the toothpaste. And so just know that's kind of normal, and not every kid fits that mold. But the bottom line is fluoride is going to be a really good thing for these teeth to protect them from those cavities.
So the last question that we always usually get is, how long do I have to brush my kid's teeth? Or, when can I transition this appropriately to, my child? The motor development on the fingers to actually do adequate brushing, that milestone is a lot higher than what a lot of parents believe or what a lot of parents think. It can be as old as 7, 8, or 9 years old, and we kind of equate it in our office to their ability to tie their own shoelaces, that motor skill, or even have pretty legible handwriting. Now, then everyone makes the joke that Dr. Shisler doesn't have legible handwriting, so I shouldn't be able to brush my own teeth. But that's kind of what you're looking at. You're looking at that level of motor development to really transition over that. So then that may be a surprise, because parents will come in, my 3-year-old can brush his teeth really great. That is excellent. You should have your 3-year-old have their turn at practicing that skill. But going back in after and having a parent's turn or adult turn is really, really important, so we can get an accurate cleaning. And that's one thing that parents will just kind of like have that aha moment and be like, oh yeah, okay. So if we can really do anything like that to avoid possible negligent or possible avoidance of getting cleaned really, really well is extremely important.
Yeah, so, bringing your kid into the dentist at a young age, get some used to us. We can provide some really good anticipatory guidance, and, ultimately the goal is making sure that they have healthy mouths. So, yeah, anything else?
Any questions from you guys?
No, this was really educational. A lot of aha moments, and pediatric dentistry is very similar to pediatric chiropractic, where prevention is the key, and we want to maintain those healthy bones. So thank you guys for tuning in.
Yeah, thanks for having us.
Thank you.
Bye.
Thank you.